And don't be surprised in any surgery. You know, Zabubursi of the Zabubursi. The Zabubursi needle holder. He was a veterinary surgeon, and he used to always tell that don't expect tissues to be as you require. You do your surgery as the tissues wanted. So you don't have a choice. Do you think it's fibroid? It's not a fibroid, it's adenomyosis. Get another day for surgery, you don't bother too much. Now a little modification we'll make is now from the myoma screw anterior, we take it off. Posterior. It's already, there's a little turn on the myoma screw, don't worry. I'm now straightening the myoma screw. Now I'm lifting it. So as you see, this bulge is definitely not a standard bulge, this whole bulge. So we will basically make an incision which is somewhere here. And maybe elliptically in this fashion. So even if it is adenomyosis, we will excise the posterior adenomyoma. Ideally yes, but if you see there is a very diffuse bulge. So you make an incision expecting that it may be adenomyosis. If it is adenomyosis, you do, as I showed you the film downstairs, then you make an incision, undermine the edges so that you can close it better. But unlike what we were seeing anteriorly, at least there is a bulge. It's enough. Take the harmonic and wolf bipolar we have brought. No? Foot switch here left side में दे देंगे. Harmonic switch is also not here. Then it switch, foot switch. And the wolf bipolar is there. That switch you can. Harmonic is checked to be on. So now we will make an incision here. Finding some planes, like this is a plane here, and slowly instantly. Better the optics. leak of gas somewhere. That's okay. Now we will make the electrical part. In the absence of harmonic, you can do the same incision with monopolar. In terms of tissue dissection, and especially in adenomyosis, harmonic is very useful. So we are taking a wedge-like tissue. Here we'll take this small little wedge out. Now the inner part looks more defined actually. So always park the specimen at the appendix. I don't understand why there is no pneumo. So now what we'll do is no, the peak may be from the port, one of the port actually. So now this is the bulge which needs to be separated. So see there, you are now getting a plane. So now we will slowly and steadily take out the entire irrigation suction there. Connect the irrigation suction. Inflow outflow tubing. What we are doing basically is we are basically trying to create a plane so that we can excise the mass properly. Over here, this looks like a tissue above the plane. This is the probable plane which is there. That's the only disadvantage with harmonic, that no matter what plane it will keep on cutting. And that's the reason why there are many gynecologists who prefer to use a Caesar to get a little bit of depth. Dr. Pandit is doing is proper. He took the specimen little below so that automatically you have a little more space to dissect. He is from Aurangabad and he is a well-established endoscopic surgeon in Aurangabad in Maharashtra and quite popular in India. These are some of the times when the surgeon starts getting irritated, because he or she wanted a nice fibroid, and there's nothing nice about fibroid here. But it's pointless, because this is ultimately surgery. So surgery is always full of surprises. So on the contrary, you have to just find out a solution out of it. Suction irrigation here. Yeah, now we will use suction irrigation to try and get a little bit of spleen. Inflow pressure कितना है? नहीं, inflow suction pressure. इनको irrigation pressure. Is it with endomet or pressure bed? Endomet है नहीं. जो gravity में जाएगा ना, you can connect the endomet if you want. Since this is the best plane where we are getting everything, we should try and enucleate from here rather than change the position of the myomous group. Just through the bone. You may occasionally leave 2 to 3% of adenomyosis. There's nothing wrong in relieving it because you need something to close on. Closer to the endometrial cavity, but nothing to panic. Even more and more towards the endometrium adenomyoma. There are a decent amount of wall left.
It's very nice. You have done a wonderful job, sir.
So you see the entire structure is stabilized. Again, park close to the appendix. Now, what we are constantly looking is that we exercise in such a way that we can suture it. So this is the wall. There is an additional wall. And some amount of redness, if it is not there, then there is a problem because living tissues will bleed. Yeah, it's not much. So now we have an option to suture with Vicryl, or we have a suture. We can suture with BARC suture. The problem with BARC suture is BARC suture will allow you to take couple of layers. Sure. The only problem is it is not a very sturdy suture. So compared to standard Vicryl, it is not that very strong. So now a major part of adenomyoma is gone. Even then, thereafter also we are having good amount of wall. There is another small aspect of adenomyoma, but that we are not worried. So basically, fenestrated plasma, दूसरा दो. दूसरा भी लिखो. So basically, what you do is you try and lift this wall. This is the main outer wall. This outer wall and this wall should get sutured without much tension, so that's not a problem. Now the issue is about the dead space which is there. In general, it really doesn't make any difference if you have a dead space. But what we'll do is we'll make it easier with the BARC suture. We will close the dead space, and then if necessary we will take the upper layer also. But as I told you, you have to remember that BARC is not a strong suture. So if you have 1 number BARC, it will be 1-0 BARC. So now we will load the BARC suture. We will show it to you from outside. So you see all the small dots. So they are the barbs which they go outside. It has 2 needles. We will simplify the story of 2 needles shortly. Some amount of glare is there, but we can introduce with both the needles together. It is polydioxone, closer to. Surgery we are doing much better off than the aviation industry. At least the dependability is much more better. It's a pleasure always to be in Dhaka, and this is probably my 3rd visit.